joining me in studio, you can't see it, our camera's recording it, and we're going to post it later to our website, but I'm hit with a sea of blue scrubs everywhere. And this is not very often that we have dentists in the studio with us. However, they're here, and they're not working on me, and it's, I'd be happy to have them do that, but, not while I'm on the air. Dr. Christopher Go from Go Dental is in the studio with us. Dr. Ryan Monty, also from Go Dental. And finally, Dr. Reagan Lawrence, also from Go Dental.
Hey, what do you know?
All three of them are here in studio, and we appreciate you guys taking the time out to... thank you for doing it. This is a practice that you guys have had for how long? How long have you been in practice, Dr. Go?
We've been at this location for about 12 years. I started this practice about 12 years ago, back in 1990, and prior to that, I'd been in Marina Del Rey. So
wait, let me check the math on that.
That would be 22.
12 years ago in 2000, you mean, right?
Yes.
Didn't I say 2000?
You said 1990.
1990. The decades just fly by, don't they, when we're doing dentistry?
Nice, when you're having fun.
Yeah.
No, listen.
That's great.
That's
he was practicing in 1990, though.
okay.
That's the problem.
But you've been up here since 2000.
2000.
And you guys are located right across the street from Valencia High School.
That's correct.
On Dickinson and Newhall Ranch Road, that area.
That is right.
Okay, very good.
Yeah.
And so you've been practicing here in Santa Clarita for 12 years. You came up from Marina Del Rey. And how did you get involved with these two?
Dr. Monty started working at my office probably about 5 or 6 years ago, and now is a full partner in the practice. And he knew Dr. Lawrence from because their wives went to dental school together, and that's how we managed to bring her into the.
It sounds corny, but this is how you meet people. This is how practices develop. And are you all three from the South End, from the Southern California area?
Yeah, we are.
Yeah.
Okay.
I'm a Lancaster boy.
Lancaster. Okay.
I'm willing to say it.
I'm from Washington, D.C.
Washington, D.C. And where are you from, Dr.
I grew
Lawrence?
up in Big Bear Lake.
Big Bear. Oh, beautiful out there.
Yeah.
Love it. So the three of you are now together, and you're now at Go Dental.
That's right. Yes. That's right.
So the three of you've been running your practice for some time now. And I'm sure you have patients coming to you they've had work done in other places. They've been around the block a few times, maybe with different dentists. What do you think distinguishes you guys from other dentists? Why do people go to you as opposed to somewhere else?
I'll field that question.
Thank you.
I think that our staff and our phenomenal people. I think we really try to create a really comfortable atmosphere for our patients. We're very patient centric, and we really try to be honest about what treatment is needed and how much is needed, and really be fair about what is in the best interest of the patient, financially and also health wise.
Yeah, because it can be expensive proposition. People with insurance or without, it can be, and you want to make sure that people aren't spending what they don't need to spend.
Exactly, and we really try to make our patients comfortable. And because we understand that going to the dentist is not people's favorite thing to do. So.
And obviously people have apprehensions and stuff about it. And
absolutely.
We'll talk about that in a minute. Dr. Go, Dr. Monty, Dr. Lawrence are in studio with us. Go Dental here at AM 1220 KHTS, thedentist.com. Got in on the ground floor on that one, didn't you? Thedentist.com. That's their website. Let me ask a question of Dr. Lawrence, and I'm going to have you get nice and close to that microphone. Lean right in, and won't be able to hear you. How often do people need to visit their dentist? Your usual checkups, routine type stuff, and then beyond that, how often do people need to come in?
You should see your dentist every 6 months for a checkup and cleaning. Sometimes if you need further work, you need to come in more frequently than that, but every 6 months.
So at a minimum, every 6 months, people go in, they get their teeth checked out, make sure nothing's going on, get your teeth cleaned, and then you go out, and then hopefully, fingers crossed, you don't have to come back for another 6 months.
Yes, for another 6 months.
And then that's the best way to kind of, I think people with their teeth kind of forget preventative stuff, maintenance type stuff, as opposed to just going in when something's hurting, right?
Right.
Right. We prefer to do maintenance. We prefer. I always tell my patients I prefer to see you every 4th of July and every Christmas, and that's it. 6 months and versus coming in for emergency when something hurts.
Visit during the holidays, and then we'll see you in 6 months.
Exactly.
Let me ask a question of Dr. Monty. See, I'm spreading the love around. You see what I'm doing like that?
See that.
So obviously, we just mentioned, patients come in and many of them have fears of the dentist. I have a friend who on Facebook, and she's my age, she's mid-30s, and last visited the dentist a couple of days ago, broke out into tears. It's just there's that fear and there's that anxiety about it.
Yeah.
So what do you guys do for those types of people? How do you help them and kind of minimize that as much as you can?
Well, I think the first thing is that I think people need to know that they're not the only ones. It's every day you get somebody who comes in and they have that fear, and they always think that they're the only one who has that fear. So I think the first thing is to kind of put them at ease and make them understand that that's, unfortunately for a lot of people, a normal part of the process. And then, going back to what Dr. Go was saying earlier about, I think what sets us apart is just the people we have in the office. It's all about just making it a comfortable place to be, about individualizing their treatment and making it about them.
Right.
And then, if they're very phobic, then there are a variety of sedation options we offer in the office too, all the way from nitrous oxide or laughing gas, which is a pretty simple one, all the way up to bringing in a anesthesiologist and doing general anesthesia in the office, and you're just out, and when you wake up, everything's done. So there's a range of options there that are available.
Because every patient is different, and you don't use the same technique with every patient. I would imagine. Have you considered a career in radio if you decide not to be in dentistry? Your voice.
Should I?
You've got
Do I have the radio voice?
You have the radio voice.
All right.
And you're like, it's not an easy thing to do. So
Don't take him.
I'll remember that.
Yes, we need him right now.
Yeah, will. All right, we'll let you stay with dentistry, I guess.
you.
Let me ask you: patients with special needs, special conditions, diabetes, special needs. Would you guys help them? Is this something that you guys do? Is something you're comfortable doing?
Of course.
It is. We've actually all had advanced training in hospital dentistry, and so we're really comfortable with patients with medical conditions from diabetes, heart conditions, transplants, things of that nature. Even special needs patients in terms of cerebral palsy or MS or things like that. We feel very comfortable administering dental care for them.
Appreciate that. Everybody needs their teeth cleaned, right?
Absolutely.
All right, let's do this. Can you guys hang out for a few minutes? We'll take a break and we'll come right back.
Absolutely.
All right,
We'd love to.
6:42, AM 1220 KHTS. We're in the studio with Dr. Go, Dr. Monty, Dr. Lawrence, Go Dental, thedentist.com. And we'll check back in with them in just a few minutes. Keep it here.
Buck McKeon, named one of Congress's most corrupt members by nonpartisan Citizens for Responsibility and Ethics in Washington. He's the last remaining congressman who took a shady Friends of Angelo mortgage from Countrywide. The others left in shame or were defeated. After 20 long years, McKeon's up to his neck in scandals. We deserve better. Time to clean house. Vote for Dr. Lee Rogers.
Paid for by Blue America PAC, Facebook.com/Blue America. Not authorized by any candidate or candidates committee. Blue America PAC is responsible for the content of this advertising.
At the Burrito Factory, their motto has always been to serve quality food with fast, friendly service. But did I mention the taste? When it comes to authentic taste and huge mouth-watering burritos, the Burrito Factory is second to none. Whether it's lunch, dinner, or a catered event, Burrito Factory has the taste of Mexico to satisfy your craving. Burrito Factory on Soledad Canyon Road next to Chi-Chi's Pizza in Canyon Country. Stop in or call ahead 288-0222.
Update your home with energy-efficient Simonton windows. Give your home the look you've always dreamed about and save money with reduced air conditioner bills in the summer and slashed heating bills during our cool winters. In Santa Clarita, there's one Simonton window and door expert, Mike's Windows and Doors. Mike's been transforming Santa Clarita homes for decades with Simonton windows that make a lasting impression. Call 296-9195 for Mike's Windows and Doors, Santa Clarita's Simonton window specialist. Mike'sWindowsandDoors.com.
Your hometown station, AM 1220 KHTS.
6:43, AM 1220 KHTS. Traffic update coming up in just a bit. We are wrapping up our segment with Go Dental. Dr. Go, Dr. Monty, Dr. Lawrence, and I'm pointing while I'm talking, but pointing at the wrong doctors while I'm saying that, but nobody can see it, and they can't even see me on the camera. That's totally fine. This is a practice that started, with friends and family. Your spouses met and have worked together before, your husband and your wife, and this is how you all met each other. You came together, you came back, here we are, Go Dental, over on New Hall Ranch Road and Dickinson across from Valencia High School.
Right.
Very good. Okay, I'm just bringing everybody up to speed in case somebody's tuning in right now. That happens. The turnover
Right.
in radio is huge. Insurance. Insurance is a huge thing for people. Some people have dental insurance, some people don't. Do you guys accept insurance? Can you tell me what kind of insurance you guys accept?
Are you gonna point at me for that?
Right.
We've already established that Dr. Go's not doing math tonight.
The
so
dentists
I
are
will
pointing
take
at
the
each other to
insurance
try and figure out who's going to have to field this question.
We accept insurance, yes. We are out of network with most insurances, but that's not an obstacle to us.
That doesn't preclude people from...
No,
Okay.
no. We can bill your insurance. You can come in, have care done with us. It doesn't change whether or not you can be seen with us if you have a PPO plan. HMO plans sometimes will restrict who you can see.
Sure.
But if you don't have a plan that restricts who you can see, then yeah, we'll do treatment. It's not a problem.
And do you guys do financing in-house as well? What do you do for that?
We have external
Okay, so people can come to you, but
Absolutely.
you'll help them
Absolutely. We'll make it
figure that
happen
out
for them.
All right, and then we're talking about dental technology, and we were talking before we went on the air about where it's going. And
Yes.
so, what do you guys have now? What's sort of the latest and the greatest things that you guys use to treat people?
I think one of the most exciting fields right now in dentistry is implant dentistry, where people with missing teeth now can go ahead and get them replaced with essentially they're really titanium posts that are placed into the bone, which sounds a lot more horrible than it actually is, and it almost it's pretty close to mimicking what real teeth feel like and look like, and so and now anymore we do it in a visit. It takes us maybe 10 minutes to 15 minutes for the actual procedure to happen, and it's done very, very comfortably. So no bleeding, nothing of that nature, and we have lasers in our practice also to assist with it. So it's I think within our practice those are a couple of the more exciting technologies.
And the advantage of that over normal dentures is what? Just it feels more natural. It feels like having real teeth again. Is that the advantage?
Absolutely.
One of them?
Absolutely, yes. They're much more secure. They're much more lifelike, and truly, our practice now, because we do so many implants, we're really the prices are coming down tremendously, and then it's much more affordable than it ever was before in the past, with a great amount of accuracy and predictability for the final outcome.
Very good. Let me wrap up by asking each of you to get out your crystal ball, and we'll look at where is dentistry going to be going in a few years now, 5 years from now, 10 years from now. What do you guys see happening? The technology improves. What happens?
Probably more computer and digital based.
Okay.
Also more prevention, more awareness now, so hopefully people won't need so much work.
I think there's a lot of things they're working on. In the early stages with a cavity vaccine. Cavities are caused by bacteria. That's the way they grow, and so they're working on vaccines that would help your immune system to fight off those bacteria that are causing cavities and gum disease in the first place. I think that computers, obviously, that everything is heading that direction. Dr. Lawrence's husband is a physician, and he's very involved with the process of computerizing treatment recommendations, that kind of thing. What really are the best practices? And I think a lot of that is starting to find its way into dentistry too, and it's going to be a big part of the practice of dentistry.
Right, and I think also not only for the teeth perspective, but the bones surrounding the teeth. I think in the future that we're going to actually be able to grow bone around teeth, so that the chance of loss of tooth structure due to periodontal disease, which right now I think is the number one cause of tooth loss, is going to be minimized and mitigated. So it's a very exciting. We're really putting ourselves out of business. Is really what
we try really hard.
Well, once there's a vaccine for your teeth, I mean, I got to imagine that
you get the vaccine, brush, floss,
right,
and then you don't need us. Dentistry tries really hard to put ourselves out of business. We advertise all kinds of products that really do work, and will keep you from getting cavities.
Very good. The website, once again, thedentist.com. Head on over there. You can find out more about Go Dental, 257-0880. I'll call them, find out any more information. Newhall Ranch Road at Dickinson, right across the street from Valencia High School. Thank you guys for coming in late on a Thursday evening. We appreciate you doing it. Dr. Go, Dr. Lawrence, Dr. Monty. And we'll have all this, the interview and the video and the audio and the telegrams and the skywriting will all be on our website, hometownstation.com. Make sure you guys check it out later. Thank you guys.
Thank you so much.
Thank you.
Take care.